You're listening to the Innovation in Healthcare podcast, produced by Health Innovation Northeast and North Cumbria, proudly improving health and care for everyone. Health Innovation Northeast and North Cumbria's Patient Safety Collaborative is a delivery partner for the NHS National Patient Safety Strategy. The Maternity and Neonatal Safety Improvement Programme forms part of that work, which includes improving the outcomes for preterm babies born less than 34 weeks gestation. In this episode, our programme lead, Julia Wood, leads a discussion with Karen Parker, Head of Midwifery at Gateshead Health NHS Foundation Trust, about the benefits of magnesium sulphate and how that has improved outcomes for preterm births in the North East and North Cumbria.
This podcast is about sustaining the gains of the administration of magnesium sulphate, and I'm Julia Wood. I am the Maternity and Neonatal Safety Improvement Programme Lead for Optimisation and Deterioration, and I'll hand over to Karen to introduce herself.
Hi, my name's Karen Parker. I'm the Associate Director for Midwifery and the Special Care Baby Unit at Gateshead Health. I'm also Midwifery Lead for the PReCePT programme as part of Health Innovations. Several years ago, the reason why I'm talking to Julia today is when we first launched the PReCePT project in the North East and North Cumbria, I was the midwifery lead kind of spearheading alongside Julia the launch of really optimising magnesium sulphate offer to some of our preterm babies.
And what's been wonderful about that work, because it was several years ago, is that we have been able to sustain the gains. And that's what this podcast is really about, because quite often what we see is improvements are made, but they're quite difficult to sustain sometimes. And this is one area among several others, but one area which we can absolutely say those gains have been sustained. So my first question, Karen, is why is the administration of magnesium sulphate important for preterm births?
Magnesium sulphate's really, really important. It's a really, really simple medication that we have, really cheap. Studies have shown that when we administer magnesium sulphate during preterm labour, the risk of that baby developing cerebral palsy is reduced by around about 30%. As I said, it's relatively inexpensive. It only costs around £1 per dose. So not only financially, but actually the impact on these babies and these families' lives is incredible for such a simple intervention.
There is research which shows, in addition to that 30%, well alongside that really, when administered to women within 24 hours before birth at less than 30 weeks gestation, magnesium sulphate prevents one case of cerebral palsy for every 37 women treated. And that's amazing really, isn't it? And we've seen a lot of traction with magnesium sulphate being administered across North East North Cumbria. So my next question though is, what are the challenges to ensuring women receive magnesium sulphate? Because it can be quite tricky.
Yeah, that's right. And I think, I refer back to years ago when we first started the rollout of the PReCePT project. And I think we felt then that it was a relatively new intervention. So I guess, as with any new intervention, one of the challenges is around awareness and staff training. And actually, how do we describe these medications to women and families in quite a scary time? So I think initially it was around that education piece. I think with any intervention, there are always risks and benefits. I think, magnesium sulphate is a safe medication. It's easy to administer. It does need to go in via a drip. But often when we've got women who are in preterm labour, they may have drips for other reasons as well. There are side effects associated with magnesium sulphate. It's really important to warn our patients of that as we're about to give it, because they're quite instant and they just make people feel a little bit grotty, quite hot sometimes. I think one of the challenges with ensuring that women continue to receive magnesium sulphate is just keeping it at the forefront of the treatments that we offer when we know that somebody's likely to deliver a preterm baby. And by keeping these all together alongside a number of interventions such as antenatal steroids, such as antibiotics, actually by producing them all as an optimization toolkit, it means that we're really focused as a multidisciplinary team when these occasions arise. And sometimes they often are quite time pressured. Then we're thinking of all the possible things that we can improve outcomes for these babies. I think it used to be that actually we were very good at giving antenatal steroids, and perhaps that is because it is an easier intervention. It's an injection that simply goes into someone's leg or arm. Whereas with magnesium sulfate, as I say, you need to have a drip, so it feels a little bit more of an invasive treatment.
And is the timing of it a challenge sometimes, Karen?
Yes, Julia, it can be. I mean, as I say, sometimes, when women come in very advanced preterm labour, there isn't a lot of time to get all of these interventions in place. And some units have introduced things like a grab bag or a grab box, so that actually, when you know that a preterm birth is imminent, you've got everything that you need at hand. You're not having to think outside the box and go off and get things. But what we do know with magnesium sulfate, more in fact than some of the other interventions, is that even if we manage to get it in just 40 minutes, ideally up to 3 hours before birth, even if with that short time frame, it can make a massive difference to outcomes for these babies. Ideally, we would get a loading dose of magnesium sulfate in more than 3 hours before the babies are born, and then have some time with a maintenance dose. But actually, even if we get that first dose in and the babies are born within an hour of getting that dose in, still makes a difference. So it's still worthwhile.
Brilliant. And I know a few years ago, there was lots of discussions about the timing of it, wasn't there? And we had lots of discussions with trusts about that you can give that dose. And so much work has been done over the past few years to increase the administration of magnesium sulfate across North East and North Cumbria. What is fabulous about this now is that we can see the gains from all that hard work, and that those gains have been sustained. So just to kind of set the scene a little bit with that, for the past 4 years, North East North Cumbria has achieved over 80%, and last year we were nearly at 90%. And these figures include those where administration wouldn't have been possible. So, for example, for those born before arrival. And I know, Karen, you did a deep dive over 2 or 3 years, didn't you, when you really looked at that data to understand those other cases. And what that showed was that nearly every eligible woman who could have received magnesium sulfate did. So that's a great achievement for the region, isn't it?
Yeah. Yeah, and I think you rightly say there will always be some occasions where it's literally impossible to give, and particularly there's babies where labour progresses really quickly, unexpectedly, and the babies deliver at home. So the fact that actually we're achieving 90%, including those cases, is amazing. When we first started to implement magnesium sulfate, there was a lot of myths around who maybe couldn't receive it, and I think involving the clinical teams, so the doctors and the consultants that are responsible for prescribing this, and actually the midwives and other staff that might be giving it, I think involving them in examining the evidence and understanding that really for magnesium sulfate there are very, very few true contraindications, reasons why women can't have it, and some of the reasons why staff thought that maybe it wasn't appropriate actually were myths that passed down through the years. So I think that was another reason why we managed to make a difference.
Yes, and we don't see that now, do we? Everybody knows, everybody understands, don't they? And I think people have worked really hard to get that message out. I think you probably know this, Karen, already, but did you know that North East North Cumbria, over the past 5 years, our data for the region shows that 19 babies did not develop cerebral palsy because of the administration of magnesium sulfate. Now that's fabulous, isn't it? And alongside that, it's just great, and it's had a huge cost benefit to welfare and society as well alongside that. So it's brilliant thing for us to promote across the region. Karen, do you have any final thoughts?
Just to say a big thank you to all of the teams, because actually, it's a small part of a really big piece of work. It's a small part of a lot of different interventions that just make a difference in babies and families' lives. And, actually, you talk about 19 babies there that didn't develop cerebral palsy because of the work that's been done, Julia. And that's massive for those individual babies and those individual families. But actually, for us in the NHS in these times where we are focused on making the best use of our available finances, the cost saving of that is, I think, somewhere between 15 to 19 million pounds, which is absolutely incredible when you think of the lifetime costs of looking after a baby that is affected by cerebral palsy. So, I think from me, it's a big thank you to everybody. In the North East and North Cumbria, we have a fantastic network of passionate preterm birth leads across all of the disciplines, whether that's neonatal care, obstetric and midwifery. And we all come together and we talk about these things and we share how we've done things well or some things where there are challenges. And I think, this piece of work is testament to the dedication of those clinicians. And so, that's all I'd like to say is a big thank you to everyone.
It's really interesting, isn't it? Because I do think that when people have worked in this region and not worked outside of that region, we take that for granted. Whereas other areas do say that how well we work together as a system, involving all the organisations, all the trusts, everyone who's involved in that. So yes, you're absolutely right. I think we do have something quite special in North East North Cumbria. We just don't always realise it, I don't think, but we should.
You have been listening to the Innovation in Healthcare podcast, produced by Health Innovation North East and North Cumbria. If you'd like to find out more about our maternity and neonatal safety improvement programme, please visit the Transforming Patient Safety section on our website at healthinnovationnenc.org.uk. We will of course provide further links and resources in the podcast show notes. Thank you for listening.